Hey everybody, Jared Wallen here. The reality is I was on my walk this morning with my pup and really just thinking about things. And I came across this article from Investopedia talking about the American Journal of Public Health study in 2019 that showed that the number one cause of bankruptcy in the United States these days is now actually medical bills. And so, the reality is 66.5% of bankruptcies are due to medical bills. And actually, over 60% of those are related to folks who actually have insurance. So you're talking about 500,000 plus folks that go bankrupt due to medical bills, 300,000 plus folks that have insurance that still go bankrupt with medical bills. And the reality is when we talk about Americans spending, $25,000 out of pocket between premiums and deductibles and et cetera, before they ever even get access to care and actually get benefits from their health insurance. Obviously, let's also talk about the fact that, technically nonprofit hospitals are supposed to be the ones that really champion for the communities and return value back to the communities by giving away free care, basically. Unfortunately, they can be, in some instances, one of the most common type of hospital to actually sue patients to go after them for paying those bills and either garnish their wages, which means taking their wages without their permission directly from their paycheck, or basically coming after them in the court system and kind of abusing and threatening them to make sure that they pay. So the reality is that the system is beyond messed up. I think the biggest thing is transitioning from that to freedom of being able to see whatever physician you want, freedom of being able to, instead of getting low quality, high cost care, getting high quality, cost effective care, and basically having more access. And the reality is that all of the items that we teach in our training and all of the folks that we work with are on that same level, want those same goals for you. Everyday Americans, employees, obviously employers too. The number two expense for most employers is health expenses. But remember, a lot of that actually comes from employee money. And so from that standpoint, that's what's hot on my mind this morning. Obviously check out selfdirectedmedical.com. Follow our social media channels and like and subscribe and share with your friends. The reality is, again, we've got a 6-week course out there that teaches you how to get free of the insurance game and get better care, get cheaper care, and really kind of get free of the silliness that's harming us all. Unfortunately, I've seen the silliness both on my end from a healer side, but also on my end from a patient side. Again, my sister almost went bankrupt due to medical bills. And so, from that standpoint, the reality is that we are all harmed by it sooner or later. And the reality is that the system isn't going to change itself. Like the Warren Buffett quote says, some of the most prominent members of society are on the hospital boards and what have you. And they think the game is working out pretty well for them. Obviously the share prices are going up. These CEOs' salaries are huge. It's just a huge scam in my opinion. And so again, get involved, get empowered, get educated, and let's make some real change. Y'all have a great Thursday.